On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. Michael Masaccio, Dr. Daniel Aldrich, Dr. Jorge Casas, Dr. Jeff Engelbaldo. Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Jim, it's not just a gorgeous facility, it's one of the top medical centers in all of the Dallas and Frisco area.
Top medical center, which of course has some of the best doctors in the entire Dallas and Frisco area that operate right here, like our first best doctor, that is Dr. Jorge Casas.
Hip replacement surgery and knee replacement surgery are two of the most commonly performed operations every year. In cases where patients develop an infection around an artificial hip or an artificial knee, a lot of times these cases have disastrous consequences.
I had 2 knee replacements in 2011, and both times they got infected. I talked to the internist and said, what happens if I don't do any more surgeries? Because I was miserably sick of having my leg sliced open and having to go through the rehab and the pain and everything. And the internist says, well, you'll die.
He had undergone a knee replacement for a worn out joint. He subsequently developed an infection of his artificial knee. When I went back to replace his knee, the defect was so large that I ended up having to reconstruct him with a design knee replacement that I typically will use for the cancer patients. Because he had already had a previous 2-stage exchange, he had a relatively large defect to reconstruct. So he required reconstruction of a relatively large segment of his femur bone. I had to remove approximately 4 inches of his femur bone because it was completely eaten away by the infection.
It's 100% better than it was 2 years ago. In all, he probably saved my leg, and he could have saved my life too.
The good news is that there's no sign of any infection coming back. He's still having some pain and some episodes of swelling, but he's better now than he had been for several years.
I'm able to do most everything I could do before, and when I pitched the pain pills, everything changed too. It makes you feel a whole lot better. Everybody says, well, bedside manner, it doesn't count. You've got to be a good surgeon. Well, he's a good surgeon. He's an excellent surgeon, and he's also a good communicator. So there's no surprises. When you wake up from the surgery, you know what you're up against, and you know what you had to look forward to.
Well, we are from Bolivia. I came 2.5 years ago. My father and my mother, they started to seeing something strange with my baby girl.
I think the very first time that I noticed, and I was the one that really noticed it, there may be an issue, was when I first held her in Bolivia. She was just a few weeks old. I just noted that she didn't appear to be responding to noise and sounds around.
I was thinking that she was okay, that nothing was wrong. Maybe she's distracting, I don't know. When they told us that she wasn't listening, it was hard because I want she can listen to me or she can listen herself. So sometimes it's frustrating that you talk to the baby or you want to teach her something and you can't because she cannot listen.
Well, we first contacted Dr. Peters in Dallas Ear Institute. Then we knew that he was the president of the foundation. of Dallas Hearing Foundation. And we talked to him, and they started looking for a device for Mia. And I'm glad that they found the right one. And hopefully, and with God help, that's gonna work good. It's gonna work good.
MED-EL, along with the Dallas Hearing Foundation, we share a commitment to the hearing loss community. And when the Dallas Hearing Foundation approached MED-EL, we thought this was an ideal situation to kind of help out a family. And so we put them into our grant process. And as the patient goes through the grant process, Mia and her family were approved.
Mia was born with profound hearing loss, and that means that hearing aids were not able to give her enough hearing. So the only way she would gain adequate hearing in order to develop speech and language, oral language, would be to have a cochlear implant. So today we placed a surgical implant that is meant to stimulate the hearing nerves that are there but just not working, and it will stimulate those nerves and produce for her a sense of hearing. We test the implant and determine during surgery that she is responding to the implant. We actually do not turn it on for 3 weeks. We want to let her incision heal. So we won't turn it on for 3 weeks. So she's just going to have, like any typical ear surgery, have some recovery time and some discomfort. But 3 weeks from now is when we'll bring them back to our office and actually activate the implant.
Wow, for her it's going to be a big difference. From not hearing to hearing is a big change. She was living happy without hearing, and now hearing she's going to be happier. That's why we're here. That's why we're in America, in Dallas, in this big hospital, good hospital, and with the best devices that she can get.
Thank you, Dallas Hearing Center. Thank you, Forest Park Medical Center. Thank you, Dr. Peters. Thank you, Linda, Debbie, all of them.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
I was having a lot of trouble with my arms, especially my right arm. I could not lift up anything with my right arm. If I went to the refrigerator and grabbed a gallon of milk, it ended up on the floor. I mean, I literally could not lift anything up, even a Coke bottle out of the refrigerator. It wasn't my strength in my hands that was affected, it was lifting things.
Classic symptoms of a rotator cuff tear would include weakness when lifting away from the body. So any type of lifting overhead or to the side particularly is very painful and weak. In other words, they lose the strength to even hold something out here. It just drops.
I've been dealing with it for probably 2 or 3 years. Didn't think anything, I thought, okay, I'll rest it for a while, it'll be okay. I'd wait a month or two, and it got so bad I was taking my hand and lifting it up to put it on the steering wheel to be able to drive.
The great news about rotator cuff repair is that they've come a tremendous way as far as making the whole experience much easier on the patient. We can repair even large rotator cuff tears through a scope. But we're not making any open incisions in any of these cases. They're all done through very tiny, 1/4 of an inch incisions. In a rotator cuff, it's not just inflamed, but it is ripped away. And the muscle that is attached to it pulls it away. So in a large tear, you could have a gap this big, where you need to get that tendon back in place. So that's where this anchor comes in, because it's very solid, it holds in the bone, and then these stitches, as you tie it, it'll pull it right back down and sit it right back down where it belongs.
Since having it repaired, I'm back to new. I have no side effects, nothing slows me down, and I've started fishing again. I've played golf twice since I've had it. Now, it hasn't improved my golf game any, but I'm right back where I was, no ill effects from any of it. Really surprising. I expected to have some type of, restraints on it or whatnot, but nothing. Nothing slows me down anymore.
Jennifer has a question for Dr. O. Her question, she's been diagnosed with HPV. What does that mean?
So I see a number of young women in my practice who come to me with an abnormal pap smear showing HPV changes, and this has these patients extremely concerned because they feel like they have been exposed to a, quote, sexually transmitted disease. Part of what I tell my patients is that the HPV virus is endemic in the population, that it's present in most people who've had sexual intercourse. For the majority of these patients, it doesn't create any issues. The body sees it and it clears it or it isolates it, and so it doesn't create a lot of problems. For a small percentage of patients, it can create abnormal pap smears, but even these abnormal pap smears can be very readily handled and treated non-invasively as long as the people keep up with their exams.
I'm currently in the OR manager position. I oversee the nurses, our RNs, our scrub techs, all of the individuals that are necessary to smooth running of the facility in the operating room. Monitor the operating room schedule to keep everything running on time, as well as meeting the needs of our patients and our physicians. I decided very early on that I wanted to be a nurse. I enjoy people. I enjoy being able to serve the needs of others, and the operating room just really stood out to me. I think the OR is an area that's it's very scheduled, it's very routine. I like to be able to plan. One thing that really stood out about Forest Park was just the quality of patient care and just the way that the patients are treated. The physicians, everybody is just wonderful. The facility promotes patient satisfaction, patient care, which are all things that are very important to me, and it's a facility that I feel like I'm very in line with their values and what they view. One of the main reasons that physicians do enjoy coming to our facility is just with the extent that we do go to meet their demands and also provide them with what they would like for their cases. We want all of our physicians to have what they need to provide effective, safe surgery, but also to meet their preferences of what they would like.
All of the doctors here at Forest Park Medical Center are dedicated to changing people's lives. Like our next best doctor, it's neurosurgeon Dr. Michael Masaccio.
Before I came to see Dr. Masaccio, I was having a lot of pain in my right leg to the point that I couldn't sometimes move, bend, or even walk.
Judy came to see me with a long history of a low back and a leg pain, and it was getting worse and creating more and more discomfort for her. The pain was starting in her back and go all the way down her leg. She did come after having seen chiropractors and failing to improve with that and trying other methods of treatment outside of surgery.
It affected just my everyday life. I could not sleep, I'd wake up in pain, so I knew I had to do something.
And what we found was that Judy had not only an instability in her spine, and she also developed a degenerative cyst. These degenerative cysts can act much like a herniated disc in that they can pinch the nerve. And in pinching the nerve, it causes a significant amount of pain and discomfort to go down through the back and the leg.
He just really did make me feel comfortable, made me feel relaxed. I knew that I was going to do the right thing by doing the surgery.
The purpose of the surgery was to not only decompress the nerve by removing the cyst, but also to stabilize the spine so that the cyst didn't recur and to help alleviate her back and her leg pain. We did use a minimally invasive approach with Judy, and that involved doing a fusion and placing bone grafting and screws in the spine, but doing it in such a way that with a computer-guided system that creates somewhat of an intraoperative three-dimensional image of the spine that allows us to use a percutaneous approach, which is to say minimal muscle disruption, and really help the computer navigate the screws into the spine with very small incisions and very little disruption to the normal tissue.
The way I feel now compared to how I was feeling before is like night and day. Before, I was just in constant pain. Now, which I can move, I can bend, I don't run, but I could. Exercise, it's just totally different. It's totally different. There's absolutely, and when I say this, I mean absolutely no pain at all. I'm glad that I saw Dr. Masaccio.
for more information on the top medical center in the entire Dallas and Frisco area, that is Forest Park Medical Center, head to the website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
And now we're going to head on over to our next best doctor. He's orthopedic surgeon, Dr. Troy Deal.
I was in a lot of pain. At that point, it felt like I had a layer of shards of glass between my kneecap and the skin on top. And you can imagine trying to bend your knee or walk with something like that.
So knee replacement entails a surgery that resurfaces the arthritic component of a knee. The patient that is ideal for this is somebody that has unfortunately lost cartilage in the knee to the sense that they now have pain, they've lost function, they've lost range of motion, so it affects their life.
My husband and I live in California. We come here every 6 months for medical treatment. So the first thing I did was make an appointment with Dr. Deal to discuss my knee problems with him. And he told me that I needed double knee replacement.
Debbie was a patient of mine that came in and she had been dealing with knee pain, actually in both knees, for a while. She had definitely gone through a long course of options in regards to treating her knee, both from an arthritis standpoint and the ability that it had on her function. She had tried therapy and different medicines and different injections, and she just wasn't happy.
When I look back, it had to have been painful, but it was absolutely nothing compared to what I had before. And the fact that I'm mobile, that I can do things again, that I feel like a human again. You couldn't talk me out of doing it again if I needed to, if I were in the same condition.
I think the idea that she comes in and is able to bend her knee and is able to walk and do all the things that she wants to do and enjoy her life without having to worry or to think about her knee or let her knee tell her how to live her life, I think is truly the success.
It is so worth it to come here for Dr. Deal to take care of my orthopedic needs because of the level of care and the level of expertise at Performance Orthopedics and with Dr. Deal.
Type 1 diabetes is a genetic condition where you're born with a lack of cells in the pancreas that help produce insulin to process the blood sugar. Whereas type 2 diabetes is more of a burnout of those cells, where they've been working so hard for so long and eventually they stop working because they've been overused, basically. Patients with type 1 diabetes typically are not specifically overweight or have poor diets or poor exercise. They just don't have, they have a lack of those cells to produce the insulin and process the blood sugar. Whereas patients that have type 2 diabetes are generally overweight, they generally have not been exercising or eating as healthy as they should have been.
Well, I just moved here from New Jersey. I haven't had any doctors in the area, so at 46 years old, I had never gotten a full checkup, so I decided it was time. I went to go see Dr. Friedman for the first time.
Mr. Foti is a perfect example. He came in for a routine check and we found that his blood sugar was very, very high. He was feeling okay, he wasn't having any issues, and just wanted to get checked out, and we found the elevated blood sugar. We then put him on medication. I talked to him in depth about diet, exercise, ways of changing his lifestyle so that he could manage the blood sugar a little bit better. And he's done so, and he's improved a great deal since that time.
Well, when I first went to see Dr. Friedman, I weighed 240 pounds and was a little bit overweight, and as he well pointed out, exercise and diet was important for me to get better. But it kind of brought me back to reality. Still with the first recheck, the cholesterol was better and the diabetes was better. They still kept me on medication for the time being. But through continuing this program, I do believe that I will be off of the medication altogether.
It's a great thing that Mr. Foti came in, because now that we have the diagnosis, we're treating it correctly. He's making the appropriate steps to change his diet, change his exercise, and improve his lifestyle.
I overall feel better knowing what's going on and what I can do to control my diet and control what I'm putting in my body which enables me to do the things that I want to get out of my body. It's been an eye-opening experience, and I'm sorry I didn't go to him sooner.
Did you know that Forest Park Medical Centers are designed and constructed to meet or exceed the standards of the U.S. Green Building Council's Leadership in Energy Environmental Design LEED program? The purpose of LEED is to reduce energy and resource consumption, minimize environmental impact, and provide healthier, more connected buildings. Throughout the building and grounds, you will see signs which highlight Forest Park's sustainable efforts.
I assess patients based on their nutritional needs, if they are at nutritional risk, if I need to do any kind of intervention as far as medical nutrition therapy, which is prescribing certain diets. For example, if a patient has diabetes, then we would order a diabetic, heart-healthy diet so that it would fit into their meal pattern to help control their blood sugars while they're here at the hospital.
Having a culinary team in place definitely gives us an avenue to provide great meals. We feature anything from gourmet pizzas to ready-made salads to order. Everything's prepared fresh right in front of your eyes, and we try to do that in a timely manner.
Forest Park Frisco Cafe Services incorporate patient and family members into our dining experience. So if there's something available down in the cafe that is not on our written menus that a patient can select from, it's still an option that a patient can receive those items from the cafe directly onto a tray up to a patient room.
With Krista, we follow a pretty strict menu that we put out of the back, but then there's also special people with allergies or people that can only have certain things. We're a small enough hospital that they really get a personal care. She touches the patient every day. She brings down the information to us, and we take care of whatever culinary needs they have.
We have people from Frisco City Hall that come and frequent our dining establishment quite often, and they let us know how well we're doing. And I thought it was pretty unique to have people walk down the street, come into this facility. They're not patients, and they don't have any family members here at the hospital, but they just want to try us out because they've heard from other staff members that work with them of how good the food is.
Our menu is not typical hospital fare. It has a lot of, I'd say, Texas twist to it. It's anything from fine dining up in the doctor's lounge to some of the caterings that we do for the doctors. And then down here, we try to do things a little more regional, use some of the local produce, try to make it more of a resort-like setting.
Food and nutrition is a lot about lifestyle changes and lifestyle behaviors, and those things don't happen overnight. So what little coaching that I do get to give patients here in the hospital is mostly through a paper that they can take home with them and do some extra research on it. We try to give contact information for the dietitians as well, so if they have questions post-op, there's always someone available or some kind of way to get the extra information that they may need.
For the last 25 years, I have taken care of everybody but myself, and I have 3 children, had them very young, and I haven't really had an opportunity to take care of myself. So it came time for me to renew my lease on my vehicle, and I made a decision to get a luxury body versus a luxury vehicle.
Mommy makeover is a term that we use to describe a combination of abdominal surgery, breast surgery, and liposuction. Breast surgery entails breast augmentation, breast lifts, or breast implants with a lift. Abdominal surgery includes most commonly an abdominoplasty or a tummy tuck and liposuction.
I wanted implants, and I also wanted my stomach fixed from surgeries, from having children. Seems like no matter how much weight I lost or gained, I just couldn't get my stomach the way I wanted.
She's very active now in running and in exercise and going to the gym, and she just couldn't firm up her lower abdominal area and her breast tissue. So no matter what she did, it wasn't going to be corrected with exercise and dieting. The plan that we chose for her, which included abdominoplasty and breast lift surgery with implants, was a plan that was tailored for her to help her with the issues she's had with her breasts and her abdomen.
After my procedures, I was actually able to go home. I didn't even stay a full day. Even having all 4 procedures done at the same time, I was able to go home like 12 hours after.
It's about a 2-week recovery of no activities. All they're doing is just walking around the house, and they're bent over. They need to be bent over to decrease the tension on their closure. After 2 weeks, they increase their activity level to mild activities. After 4 weeks, it's moderate, and after 6 weeks, they can fully engage in whatever activities they were doing prior to surgery.
I'm very pleased with the outcome, and I'm very comfortable. I was looking for something a little more natural, not so it looked like I was having procedures done, and he did exactly what I asked.
Did you know that Forest Park Medical Center was voted as one of the top 100 places to work in the Dallas-Fort Worth area? Forest Park Medical Center received this honor for the 2nd year in a row.
What we found is that there's a new technology for treating reflux that can get people off of their medications. The problem is, because surgery hasn't been used in 20 years or so, we didn't have a good way to evaluate the patients. Those centers were spread out throughout the state, frankly, and we decided that there was a need to have a center put together that could do all the different types of diagnostics that we need to identify reflux patients. Forest Park stepped up to the plate. They bought all the equipment. We got associated with some of the gastroenterologists in town that we hadn't done any work with before, and they've taken the lead to run the center, to do the diagnostics, and to give us the information we need to appropriately treat the patients. We do pH studies. We do pressure studies of the esophagus called manometry. We also do regular endoscopy to look and obtain pathology specimens. And the best test that we have now is called impedance. Impedance is a test in which we're able to actually measure the movement of fluid up and down the esophagus. So where the fluid may not show up in some of the other tests, for sure it's going to show up in this test. The difficulty that we had in the past was we were sending patients one place to get pH, another place to get manometry. We had to send patients down to Houston to get impedance. And so now having all that equipment in one space becomes very convenient for the patient. I think because there's so much information out there on the internet, on the TV, people understand that they have a problem. They have reflux, but they don't understand all the options that are available. When they come in to see me, I'm going to talk about their symptoms, how they relate to reflux, whether it may be due to some other disease process. We're going to talk about the anatomy. We're going to illustrate the anatomy to them in pictures. And then we're going to talk about the different tests that we need to do to confirm that this is actually what we're dealing with. And then we'll talk about surgery if it's indicated. And rather than having to send patients across the state to get that study done, it's something that we could do right here in Forest Park, Dallas.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center. Of course, Jim, Forest Park Medical Center, one of the top medical centers in all of the Dallas and Frisco area.
For more information on Forest Park Medical Center, the technology, as well as the outstanding doctors that operate right here out of Forest Park Medical Center, head to the website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab.
And if you have a question or comment for us, or if there's a doctor from Forest Park Medical Center that's changed your life, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.